The purpose of this analysis is to identify areas where a mental health professional shortage area, HPSA, are overburdened by ED visits and inpatient stays. This scenario explores county HPSAs related to the mental health, use of the ED, and hospital and county demographics. Counties are categorized as either being in an area without HPSA, partially, or wholly. For the data visualization, it is recommended that you enter full screen mode by clicking the icon in the lower right corner. The upper left table of this dashboard shows the poverty rate for each state. The upper right table shows the poverty rate broken down by HPSA designation. The map in the lower left shows the poverty rate for the selected states. The scatter plot graph in the lower right shows the relationship between poverty rates and ED visits. Each point on the plot represents a specific county. Using this dashboard, we can filter data to a selected state and HPSA designation. For this example, we will select Tennessee from the upper left table by scrolling down and selecting TN with your mouse. The map, the scatter plot, and the data in the HPSA table will now display the data for Tennessee counties. We can see that Lake County has the highest poverty rate at 42.7%. The scatter plot shows that there is a slight negative association between poverty rates and the average number of ED visits. That is, as the poverty rate increases, the average number of ED visits decreases. We can filter the data further by selecting the HPSA designation to whole, where only data is displayed for counties considered to be in areas of shortages in health professionals and mental health. With this filter in place, the number of counties is limited further, which includes Lake County. Interestingly, we see that in counties with shortages in mental health providers, there is a positive association between poverty rates and average ED visits. That is, as poverty rates increase, the number of ED visits increase. The use of this dashboard can reveal the relationship of mental health provider shortage areas to poverty rates and the impact this may have on ED visits. In Tennessee, we see that in mental health HPSA counties, there tends to be a stronger positive association with ED visits. This can indicate that when there is not enough mental health providers in a specific geographic setting, this may lead to greater ED encounters.